Hi, my name is Ashley Timmins, and this is my sister Jessica, and today we're doing a nutritional counseling session. I'm sitting down with her today to talk to her about her food choices that we have been tracking over the past 3 days and how her food choices affect the health of her oral cavity. So, by doing this today, I hope to give her a little knowledge about the food she eats and recommend some changes to improve overall oral health. So before we sat down, I had you fill out a health history and did an intra and extra oral exam. The oral exam was good. I didn't see anything that stood out or anything that would prohibit you from getting proper nutrition, such as a dry mouth or anything like that. Also, looking at your health history, the only thing that stood out is that you are pregnant and that you take prenatals. Is that correct?
Yes.
And your prenatals contain folic acid, which is super important for you to take during pregnancy, especially during the first trimester, because a deficiency could lead to birth defects such as spina bifida. So even though you are getting the folic acid from your prenatals, it is also found in things such as lentils, flour tortillas, dark green leafy veggies, and orange juice. Do you eat any of these regularly?
Yes.
Okay, perfect. So you're getting a good amount of folic acid for your baby. Also, do you have any food allergies that could prohibit you from getting certain nutrients such as a strawberry or nut allergy?
No.
Okay, perfect. So now I made this flip chart to help aid in my counseling today. So I'm going to throw some terms at you. There's also some information here that you can take home as well. So first is the caries process. So caries equals decay, which is known as your cavities.
Okay.
So the process to get decay is you eat sugars or carbs, and then they mix with the bacteria that's in your mouth, which creates an acid. So this acid then sits on your healthy tooth, and if it's not properly removed by brushing, rinsing, it will form the decay.
Okay.
So food choices that promote decay are bread, sodas, chips, anything processed, and milk. The next term is karyogenic. So karyogenic foods are foods that promote or produce decay. They are fermentable carbs, such as sticky foods, highly processed foods. The main ingredient in these foods is sugar, which is the main factor in the decay process. So examples of karyogenic foods would be crackers, cookies, fruit roll-ups, milk, any of your fruits, and then breads.
Okay.
So then the next one would be non-karyogenic. So it's going to be the opposite. It's foods that do not promote or contribute to decay. They don't contain sugar, therefore they are not cavity causing. These are your proteins such as eggs, fish, meat, most of your vegetables, and your fats. Also sugarless gum. It contains an ingredient called xylitol, which after eating it, after your meals, it actually helps wash away those sugars and stop cavities from forming. Do all of these terms make sense to you? Perfect. So I also had you go through your list of foods you ate in the last 3 days and had you circle everything that you thought was karyogenic or things that you thought caused decay. And it looked like you circled almost everything that actually doesn't cause decay. You circled your eggs, your vegetables. You did circle your honey mustard, which that has sugar in it because it's processed. Your veggie egg rolls, that would be karyogenic just because it has breading around it. It also looks like you circled your milk, your mayonnaise, your butter, your mac and cheese. Those would all be karyogenic because they have sugar in them as well as your syrup. So you did a good job. It's just those vegetables don't because they don't have sugars in them, and then your eggs wouldn't be because they are a protein source. So the main thing here is that sugar causes decay, and sugar is a carb, correct?
Yes.
Perfect. So now we're going to talk about carbs. We have simple carbs and we have complex carbs. Your simple carbs are going to be your sugars, and your complex carbs are going to be your starch and fiber. So carbohydrates provide energy to live and fiber to eliminate waste from the body. All right, so your complex carbs are going to be your starches and fibers, as well as necessary vitamins and minerals that your body needs. They break down slowly, therefore they provide your body with lasting energy. Some foods that are complex carbs are also cariogenic, therefore they do promote tooth decay, but they are not fattening. So examples of complex carbs would be green vegetables, whole grains, whole fruits because of the fiber, potatoes, corns, beans. And then your simple carbs are going to be your sugars. So they are quickly digested, therefore they are a quick source of energy. Since these carbs consist mostly of sugar and artificial sweeteners, they are promoting tooth decay, and simple carbs are also fattening. So these would be syrups, candies, sodas, dairy, alcohol. Do those carbs, the differences between those carbs make sense to you?
Yes.
Perfect. So after you gave me your list of foods you consumed, I plugged them into the Choose My Plate website so that I could get some nutritional info about the foods. So I'm sure you're familiar with the food pyramid, and the Choose My Plate is quite similar to that. So we have our grains, which half of them you should be getting at least whole grains out of them. Your vegetables, your fruits, your dairy, and then your proteins. These are all things that you should be getting on a daily basis. So it looks like you were under on your whole grains and over on your refined or processed grains, and we want this to be switched. I would choose whole grain bread over white bread, and maybe add in some whole grain oatmeal as well. Does that sound achievable?
Yes.
Perfect. You were also under on your veggies. Do you enjoy veggies, or what are some of your favorite kinds of vegetables?
I'm not really a fan. I would say probably green peppers, cucumbers, carrots.
Perfect. Well, getting those in every day will really help out not only the health of your body, but also your oral health as well. Okay. You also didn't have any fruit down at all. Do you eat fruit regularly, or were the past few days just busy and you didn't get them in?
Fruit's not my favorite.
Not your favorite? Okay. Well, if you were to eat fruit, what kind of fruit do you eat?
Blueberries, strawberries. I like berries.
Berries? Okay. Well, those are decent as long as you're getting those in abundance. So you were also under in dairy, which is important for keeping our bones and teeth nice and healthy. So adding in more milk, cheese, or yogurt will help you out.
Okay.
Even though these foods do promote cavities, they are still important for our bone growth. So we want to make sure we're getting those in. Okay. So another report that I got off of your food list was a nutrients report of the vitamins and minerals that you consumed, and it looks like you were also under on a few of those things. So I know that you do take prenatals, which I took a look at the back of the label, and they do contain all of these. So even though you're under with the foods you consume, you're getting them as a supplement during your pregnancy. So you're under on vitamins A, C, D, E, and K, as well as choline. I'm not too worried about some of them, as like I said, you're probably getting them from your prenatals, but the levels would be increased by some of the fruits and veggies we talked about earlier. Okay. So vitamins A, D, E, and K are fat soluble, which means your body can store them, so you don't need to get these every day. Okay. Vitamin D is a sunshine vitamin because we get most of our intake from the sun. Our body needs sunlight at least 5 to 10 minutes, 2 to 3 times a week. Do you think you meet this? Do you go outside at all?
I don't meet that. I have an office job.
You have an office job. Do you go outside with your daughter at all ever?
Yes.
Okay, perfect. So I'm sure you get outside at least 5 to 10 minutes, 2 to 3 times a week with that. So vitamin D helps us absorb calcium. So not having enough vitamin D can cause osteoporosis, which is the weakening of our teeth and bones. And we need strong, healthy teeth in order to consume a proper diet. Does that make sense?
Yes.
Perfect. Another vitamin you were low on is vitamin E, which helps prevent oral cancer and is also an antioxidant, so it helps keep your immune system running. Mm-hmm. The vitamin can be found in salad oil. Do you eat salads ever with dressing on it?
Yes.
Perfect. well, then you should be getting enough vitamin E. You are also under in vitamin A, which helps build and maintain healthy tissues and is also essential for bone growth, which is needed to keep our teeth and gums healthy. Do you know any foods that vitamin A is found in?
Oh, no.
Okay. It is found in eggs, red, yellow, and dark green fruits and veggies, such as spinach, squash, sweet potatoes. Do you like any of those?
Yes.
Perfect. Then let's get those into your diet a little more often. Help out with that. The last vitamin that you were low on is vitamin K, which is made by a bacteria that is in your intestines. It helps increase your bone density, which keeps our teeth healthy. Vitamin K is found in dark leafy green veggies, which you said earlier you don't really like. But if you would eat, maybe mixing in some kale or spinach in with a smoothie, then you would get those in.
Okay.
One vitamin that is important for you is choline, which you were under in. It is important because you're pregnant. You should be getting enough of it from your prenatals, though. But you can also get it from broccoli or cauliflower. And if you don't get enough of it, it can cause angular cheilitis, which is swelling of the lips. It can also cause halitosis, which is bad breath, and it's worse than just not brushing your teeth. It's very, very bad breath. Or glossitis, which is a sore tongue. So I definitely want to make sure you're getting enough of this, which that was also on the back of your prenatal label. So now we will talk about some minerals. So one you were low on was potassium. Do you know any sources of potassium?
Bananas.
Perfect. If you eat these, not only will you get more potassium, but you will also increase your fruit intake for the day. So some deficiencies we see with low potassium levels are muscle weakness, which affects your heart, and we need a healthy heart for healthy teeth. So another was magnesium, which helps with bone growth to keep your teeth strong. So without this, it can lead to weaken your alveolar bone, which is the bone that holds your teeth in. And if it is weakened, our teeth can be affected. So a source for this would be almonds, cashews, whole grains. Do you eat any of those, or would you enjoy any of that?
Sure.
Perfect. So lastly, you were low on iron, which I'm sure your prenatal also has it in it.
Yep.
Iron aids in the formation of hemoglobin, which is in your blood, and it's what the oxygen attaches to get nutrients around your body. So without iron, we can get oral sores or a burning tongue. Do you eat, or do you know of any foods that have iron at all in them?
Red meat.
Possibly, I'm gonna say we're gonna try to find more of iron in dried beans, nuts, potato skins, egg yolks. That's gonna be where most of the iron is gonna be at. Do you eat any of those?
Yeah.
Okay, perfect. So I explained different food choices for you to meet the daily needs and to help improve your diet for a healthy body and mouth. I'm not asking you to eat these daily, but if you could add them in, it would help your overall health. Does this sound reasonable and achievable for you?
Yeah.
Would you change any of these food suggestions?
No.
Perfect. So just like deficiencies can be bad, so can overages. So you were over on sodium and cholesterol, which can affect your heart and the way your body will work. One way to lower sodium would be to avoid processed foods and choose fresh fruits and veggies.
Okay.
To lower your cholesterol intake, I would recommend removing the yolks from your eggs when you eat them. So if you're gonna make eggs, say you have 3, I would leave 1 egg yolk in, and the rest I would take out. So the last thing I want to talk to you about is water. So you get a decent amount of water from what I see in the past few days, and it is recommended that we drink at least half of our body weight in ounces of water each day for proper body function and detoxification. Also, washing your mouth out with water after meals can help reduce your chance for cavities, as it will rinse out any of the cariogenic foods that might be stuck in your teeth. So after drinking, instead of swishing it down with soda, swish it down with some water at the end.
Okay.
So did you learn anything from today's session that stood out to you?
Yeah, I have quite a few changes I can make in my intake. I would say that just just by adding some more greens to my diet could advance a lot of the things you talked about. And it's interesting that the things you think hurt your teeth are not exactly the things that are hurting your teeth. I would have never thought that a piece of bread was going to give me cavities.
Yes, so basically adding in dark leafy greens and eggs is the miracle diet to put everything you need into your body. So thank you for letting me sit down with you today, and I hope this information was useful and something that you can teach to your children as well someday.
All right, thanks, Ash.